Welcome, everyone, to the Melanin Initiative podcast. I'm Alicia Brown and one of your co-hosts for the Melanin Initiative. This is Geraldine and this is Kimberly. In healthcare, there's often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space to ask your questions and share our nursing perspective without taking up too much of your time. Today, we'll be talking about pancreatitis. By the end of the episode, it's our goal you'll be able to describe what the pancreas does, define pancreatitis, describe pancreatitis signs and symptoms and some complications, discuss risk factors and preventative measures, and diagnosis, common treatments, and the risk of reoccurrence. Kimberly, tell us about our disclaimer.
Okay, remember everyone, this show is for educational purposes only. The opinions expressed here are our opinions alone. They are not a representation of any of our affiliations. If you are experiencing a medical emergency, you should seek medical guidance and medical attention from a healthcare provider. If you're having a physical emergency, you can call 911. And if you're having a mental health emergency or know someone who might be, you can call 988.
Absolutely. All right, Geraldine, let's get started. What is the pancreas and what does it do?
So the pancreas has two roles. It's an organ of the digestive system as well as the endocrine system. The pancreas produces enzymes that help us digest our food, particularly protein. And the pancreas also makes the hormone insulin, which helps us regulate our blood sugar levels. So disorders of the pancreas include acute or chronic pancreatitis, as well as pancreatic cancer and diabetes.
So you mentioned some big words, endocrine system. And that's typically associated with hormones. And what was the other one? Digestive?
Digestive.
And that's breaking your food down into energy you can use or let it out and have a bowel movement. And pancreatitis is just the word pancreas with itis at the end, which is usually associated with inflammation or infection. Yeah, because if you have an infection, you're definitely going to have inflammation. But if someone just punched you in the stomach, you might just have inflammation.
Exactly. So along those notes, we're going to talk about pancreatitis today. So as Geraldine mentioned, there are two types of pancreatitis. So first we're going to talk about acute or sudden or it's happening right now pancreatitis. And then we'll talk a little bit about chronic pancreatitis, which is reoccurring and it happens over a longer period of time. So acute pancreatitis is the inflammation or swelling of the pancreas. It's a medical emergency and requires prompt treatment. It occurs when the pancreas suddenly becomes inflamed or swollen and the enzymes can't leave the pancreas and it causes irritation and burning. This happens when digestive juices or enzymes are attacking the pancreas. As you can, for those of you who are listening in, there's a picture on the screen of pancreatitis and that pancreas, that little yellow piece there, it looks red and it's inflamed. And as you could imagine, it'd be painful, right? So the most common causes of pancreatitis are drinking too much alcohol, which is alcohol-induced pancreatitis, and gallstones within the bile tubes, which is related to your gallbladder, also called gallstone pancreatitis. Pancreatitis. Some other factors that may trigger acute pancreatitis are pancreatic cancer or having a tumor, belly injury that Kimberly mentioned, or having surgery, high levels of fat or triglycerides in the blood, very high levels of calcium, certain medications such as estrogen or steroids or diuretics, medication that make you pee, infections such as mumps, hepatitis A or B, or salmonella, cystic fibrosis, certain genetic defects, some abnormalities that happen in birth, trauma or
body where you can actually find your pancreas. And so we have an image here on the screen that shows it's right behind your stomach. And so when people have pancreatitis, are going to come in complaining of abdominal pain or belly pain. And as you can see, there's a lot of organs in that area. And so it might take a little while to figure out what's actually causing your stomach problems, especially if this is the first time. On the next slide, as Alicia pointed out, we're looking at a close-up picture And you can see the other organs that are nearby. And you can see when we get into the other signs and symptoms, why you might be having these other signs and symptoms. And inflamed is another word for inflammation. And it just means that there's some injury to your body. And so the way your body responds is by bringing in more fluid. That includes things like your white blood vessels, your red blood cells to repair that part of the body. And because we're talking about small spaces, anything that isn't normally there is going to take up space, and that space causes pain, that extra volume.
Thank you, Kimberly. So before we get into signs and symptoms, I'm going to talk a little bit about chronic pancreatitis, and then we'll talk about what does all this mean? How are you going to feel? So chronic pancreatitis just means it's recurring. It happens on a continuous basis. That pancreas gets inflamed. And this is happening even when you haven't been triggered, such as if you're drinking alcohol. So alcoholics are at increase of developing this condition. This relentless inflammation eventually damages or destroys part of the pancreas, which reduces its function. And then some symptoms for that would be digestive upset and passing fatty or foul-smelling stool. So let's talk a little bit about what signs and symptoms you actually will experience when you have pancreatitis.
I think this is an important topic because most people have never heard of pancreatitis
Right.
until they get diagnosed. And it's quite common in the hospital. And actually, what we used to say is there's seasons, like as the year goes on, there would be like seasons throughout the calendar where you have a lot of people coming in with pancreatitis. And as Alicia mentioned, we mostly saw alcohol related.
Right.
Trauma could also be maybe there was a surgery to a nearby organ. You saw how close they are. Maybe they hit it by accident and now you're having problems there. But we mostly saw the alcohol one. So think about 4th of July, all these winter holidays, anytime it's a festive time of year and people choose to celebrate with alcohol.
Oh, yeah. Party pancreatitis, right? So Kimberly, why don't you talk to us a little about the signs and symptoms?
Okay, so you're going to have really, really bad abdominal pain, particularly after eating. So if it does get so bad that you're in the hospital, the first thing we're going to do when someone comes in with abdominal pain is tell them they can't eat or drink. Because why would we want to keep sending things down there if we don't know what's down there? And if there's a blockage, it's just going to come back out the way it came in. And we want to avoid that until we can fix it. You're going to have pain in your upper abdomen. So then what you might say is like, we'll say, oh, where's your pain? And you say, yeah, it radiates to my back. So then depending on your history, you might actually come in and tell me, oh, it's my kidneys, just because in the past you've had like kidney problems and the pain was in the back.
Right.
So it's so close to your heart. So anybody who has even heartburn, they might first rub it off. And it's like, oh, it's just my heartburn. They might take Tums for 12 hours and then they realize it's not going anywhere.
Right.
Upset stomach, that's obvious. That can lead to indigestion, feeling bloated because you saw how close it is to the small intestine. And so that's going to interrupt food and digestion. And they've mentioned the word enzyme a few times. And that is it's a molecule that speeds up a reaction. And so your body has those and it helps break food down. But if your organ, particularly the pancreas, isn't working, it's not going to break food down like it's supposed to. Fever, particularly if you have an infection is typically associated with a fever. Unwanted weight loss because you haven't been able to eat. The nausea, vomiting, that upset stomach, you've got all that inflammation and that inflammatory response taking place. And so naturally, you're going to feel like, and also because your liver is starting to get a little bit involved. And so you're going to have some nausea, vomiting happening there. Your stinky, oily stool. That's one of those symptoms that really starts to help us narrow down your diagnosis, especially when you're coming in with abdominal pain, which could be related to anything. Belly's going to feel, I know you're not going to want to, every time someone comes in, they're going to want to touch your belly. And because you saw all those organs, certain ways that we touch the stomach lead us more closer to one organ than another one. Okay. We apologize for that, but it is kind of one of the only ways to get to the right diagnosis. Diarrhea, same thing, because your digestion is messed up and those enzymes aren't being able to work like normal. So you can have some bleeding. Actually, that's not unusual for people with pancreatitis to have some bleeding, especially in the rectum and in their stool. And then dehydration because they can't keep anything down. So again, when you come in, we're going to tell you can't eat, but we're going to hook you up. We're going to place a catheter in your arm, hook that to a bag of fluid, and we're going to give you fluids until your inflammation or infection is resolved.
Perfect, Kimberly. Thank you. All right, Geraldine. So someone's coming into the hospital. We suspect they have pancreatitis. They've presented with some of these symptoms. How do we diagnose them?
So first we start off by getting a history of their present illness. So we go over signs and symptoms, like talk to them about what they're experiencing. And from there, we go on to that physical exam where we are touching the abdomen. It's can be uncomfortable, but like Kimberly said, it is necessary for us to narrow down what is going on. In addition to that, we do blood tests that kind of also help us narrow down what's going on. And then one of the most important tools, I think, is imaging. So we do belly or abdominal x-rays. We take a look at your belly, see what's going on through that. There's also ultrasounds that we're able to do, ERCPs, which is the common one that we see in the hospital, ERCPs and MRCPs, where basically they put a scope down your throat.
A little camera.
With a little camera that kind of helps the provider assess what's going on and in which areas. And then the same thing with the MRCP, that's MRI, which gives us like a more detailed image of the pancreas and other surrounding organs as well. So that helps us narrow down what's going on.
Exactly. And so you've already been not allowed to eat. But let's say, for instance, you were eating up until this point, and now we want to order we want to order the imaging.
Mm-hmm.
So at midnight, you won't be able to eat or drink. And if you were not on fluids, we'll put you on some fluids. You mentioned lab work. An important one is lipase, right? It'll typically be in the thousands, which is abnormal. And so we'll check your blood every morning to see it going down. That's a sign that you're improving, as well as your reports that your pain is improving. And then we're still going to check your blood count, risk of infection, and how your liver and kidney are handling this trauma to the pancreas.
Wonderful. Thank you. So you may be wondering, what puts you at risk for developing pancreatitis? So some factors that increase your risk include excessive alcohol use. You're going to hear that from us a lot in this particular subject. So research shows that having 4 or 5 drinks a day increases your risk of pancreatitis. Cigarette smoking. Compared to non-smokers, smokers on average 3 times more likely to develop chronic pancreatitis. Obesity, diabetes. As you may be thinking, some of these things sound familiar, right? Exactly. And then a family history of pancreatitis. A number of genes have been linked to chronic pancreatitis, and a family history of the disease is linked to an increased risk, especially combined with other factors. So let's talk about prevention a little bit. What can we do to make sure we don't get pancreatitis?
Well, we can limit our use of alcohol. You know, it's actually, we hear it all the time, but when I've talked to a lot of patients, they've never heard that there's a recommendation for a daily limit on alcohol and that it's different for men and women.
That's a good point. Yeah.
So I think for men, it's 2 a day. They can have 2. And for women, it's supposed to be, it's supposed to be less than 1 a day.
Right. Well. What else can we do?
Oh, comes back to that heart healthy diet. And by heart healthy, we just means low in fat and also low in sugar. Those are gonna be kind of your main things. That fatty food not only increases your risk for things like heart attack and stroke, and of course the sugar, the diabetes, but it just clogs your blood vessels, right? And your blood vessels are everywhere, so every organ can be impacted by that.
Also, exercising regularly and losing excess weight can help reduce your risk for pancreatitis, and also skipping crash diets. So a lot of times, we want to lose weight and then we start those diets, and when we go back to our regular diet, your liver ramps up and the cholesterol production increases in response to that. And that also increases your risk for gallstones. As you saw in the picture that we had up earlier, your gallbladder is pretty close to your pancreas.
And so in the hospital, you'll see the emergency physician or provider, whoever's covering at that facility. And then even though you might go to a regular floor, they might consult the GI or gastrointestinal team, and they will specialize specifically in that organ, give the recommendations for that organ. But your primary care team, internal medicine, we'll make sure everything else is still functioning like it's supposed to. And then you still get all the medications that you take, if you take any, when you're supposed to take them.
Another main thing we like to stress is don't smoke. A review of studies published in 2019 in the Journal of Pancreatology found that adults who smoked were 1.5 times more likely to develop pancreatitis than non-smokers.
And I think pancreatic cancer, which is a really difficult one to treat. And we talk a lot about stopping smoking, or what we call smoking cessation, to quit, to stop. And we know stopping smoking is very hard. Many people start and stop all over again, but we have wonderful tools out here, including medications that can help you, that can help decrease that sensation, gum, patches, programs. All you have to do is step forward and say you're ready to take that step, and we can help you with that. And when I say we,
primary care. Primary care provider.
Yeah, and I'm sure there's a ton of stories you can see on YouTube, hear other people's stories, other ways that they found to cope, because you have to replace that with something else.
Right.
And hopefully you replace it with something that's
healthy,
good for you.
Exactly. So we've come into the emergency department. We've got our scans. We have the official diagnosis of pancreatitis. What do we do now? How do we get treated for this? So the ultimate goal of treatment is just to let that pancreas heal, right? Healing is key here. So in most cases, you will be in the hospital for a few days. As Kimberly mentioned, we're going to be giving you IV or intravenous fluids through a catheter in your arm. We will be giving you pain medicine, and medicines that may be fighting a bacterial infection are called antibiotics if you have an infection. If mild, you may be able to eat clear liquids or a low-fat diet. However, if severe, you may not be able to eat or drink for a few days to let the pancreas rest, which is the key point here. And then in some situations, depending on how severe it is, a feeding tube may be used to give you the nutrients you need if an IV catheter with IV fluids is not enough to keep you well nourished. Pancreatitis often gets better in a few days. If any problems happen, treatment could include placing what we call a nasogastric tube, which is basically a thin tube that goes in through your nose, down to your stomach. And it helps to, one, help the pancreas rest, but also if vomiting is a problem, it'll help get those fluids out of you. And the tube can be used for as short as a few days to as long as a few weeks. And like I said, it helps remove fluid and air, and it helps give that pancreas time to heal. We can also do the opposite, and it can also be used to give you nutrients, which is that food. So depending on what you need is how we would use the nasogastric, we call it NG2. So once again, to remove fluid if that's necessary, or to give you nutrients.
And that NG tube is no fun for anyone.
Yeah, we're gonna be honest with you. We don't like placing them, and patients don't like receiving them. Okay, it's an experience for all. So if you are having a pancreatitis flare or having pancreatitis and you have to get an NG tube, where it's going to be a painful experience. And then we already talked about ERCPs, and then another.
Everyone is scared of these.
I know.
We end up fighting sometimes.
Yeah.
With the patient about emphasizing how important it is to have it, and we can go 2 shifts, even 48 hours, because they just refuse to have it. Because sometimes they have had negative experiences.
Yeah, it's not very comfortable, but
once again, the ultimate goal is to let the pancreas rest, right? So
you just have to think about the end goal,
right?
Just
sometimes if there's no other way out,
we got to go through.
Yeah.
Right. And then if gallstones are the cause of your pancreatitis, another step would be removal of the gallbladder.
Really, that's a super common one. Yeah.
All right, Jody. So, worst case scenario, what are some complications that could take place?
So with chronic pancreatitis can get better on its own. It can take longer, but that can take a little bit longer after you've had like a few pancreatitis flares or attacks. Chronic pancreatitis has a greater risk for long-term problems such as diabetes, chronic pain, diarrhea, unwanted weight loss, low vitamin levels, or malabsorption. And it could be from not like eating or getting the right nutrients. A collection of fluid, which are also known as pseudocysts that form around the pancreas, bile duct blockages, which can also be painful and uncomfortable for patients, permanent pancreas damage, as well as pancreatic cancer and necrotizing pancreatitis.
That's a bad one.
Yeah. That's when the tissue around the pancreas is starting to die. And once that pancreas tissue is no longer working, it's not coming back. So you're losing function. And as we mentioned, the whole purpose of the pancreas, it helps with secreting insulin and blood sugar management and digestion, right? So those two things will be affected if it's not working.
They're necessary for everyday function.
Every day.
Even it's funny, you don't really hear about the pancreas, but it plays a
huge role.
Yeah. There's no pancreatic. There might be a little transplants out there, but they're rare.
Right. All right. So we gave you a lot to think about, right? We both, we're wrapping up our show for today. So Kimberly, take us home.
So today we talked about pancreatitis. We started with review of the anatomy. You can find it behind your stomach. It can get inflamed or infected. Both cases, you're coming in with abdominal pain, and you might have things like nausea, vomiting, or diarrhea. You might have a one-time episode, or it might be recurrent. In the hospital, you're going to not be able to eat, and you're being given fluids, have a round of imaging, and then we're just basically time as our friend in that case. If it's chronic, you might take enzymes by mouth every time you have a meal or a snack. And then we talked about how you can prevent it, which is the things we talk about all the time: lifestyle, what you're eating, how much you move, how much you consume in terms of alcohol and smoking. Oh, so yeah, you remember, thank you so much. You can email us your questions or show ideas at tmi.melanin@gmail.com. Subscribe to our YouTube channel and follow us on Instagram, TikTok, and Facebook. Please share the show with your friends. Rate us on the Apple Podcasts and Spotify. It really helps you support the show. So many of you want to find out how you can support us. That's one of the number one ways you can do it. And it gets the message out there to the people who really need to hear it. You can find our social media links and any resources that we brought up today in your understanding of pancreatitis or getting support in the description box. We release a show weekly on TMI Tuesdays at 10 a.m. But if you can't catch it at 10 a.m., it's always there. Go back and watch all the old episodes in season 1 and start with season 2, episode 1, where we talked about primary care if you haven't already. Follow, like, share, comment, tell all your friends about us. Thank you, ladies, so much. Thank you all for watching. We'll see you next time.
Bye.